as we went over your pink sheet, these precautions are based on CDC guidelines. I didn't just dream them up one day because I was bored. And the precautions are obviously contact, droplet, airborne, standard, and protective, which is also neutropenic precautions. Now, under contact precautions, you will have those key bold words up at the top in red, and you will have everything that goes under it underneath the column. So that's kind of how it's organized. I have no idea where this came from. It's just that as I have taught this for years, I said maybe 10, maybe 15 years ago, it would be better if I just put this in columns, okay? Columns that make sense. So when we think about contact precautions, we're talking contact. I touched you. Or, here's one that we forget, I touched an inanimate object. So I touched you, or I touched an inanimate object that you touched. You know what that is. That's side rails, call bells, elevator buttons. That's why we never push the elevator button with our finger, ever. We use a knuckle or an elbow, because on that elevator button is all kind of garbage, okay? Nurses who get it, after today I'm sure you will, never go to buffets, ever, because you would not believe what buffets are cultured from, like E. coli and all of this stuff. We don't go to buffets. Nurses are just like, oh, no. All right, droplet precautions means just that. Droplets from the nose or the mouth, and they are breathed into the person that is within 3 feet away. And that's why we have the blue couches. Because if you come to class and you're sick, and certainly summertime is not a high time for a peak time for sickness, but if you do come to class and you're ill, or I hear you coughing and sneezing and doing all this nonsense, and it's not allergies, I will direct you to the blue couches. Because look how close you are. You're definitely within 3 feet away. And all of us nurses are really at risk for getting sick. So we're not in the mood to sit by someone hacking up. And you know how it is. They start that coughing, you go, oh my God, I just want to slap her because she's sitting right next to me. I just want to slap the little infection right back to her face. Because you can't. I mean, you just can't believe that they're sitting there doing that. So we have much respect for patients. If we show up to work sick, we got a mask on. All right. Airborne is really curious. Airborne is the worst. It is the most severe, strict precautions we could implement. And essentially, it means that this infectious material stays suspended in the air for more than 30 minutes. For more than 30 minutes. And if you are exposed to the patient for more than 30 minutes, you most likely have a high risk of getting this infection. So airborne is crazy. Airborne also is a little bit complex because many diseases like chicken pox or measles are infectious before you see lesions. So chicken pox, for instance, is infectious for 3 whole days before any child breaks out in the lesions, in the little vesicles. That's crazy. So this is airborne. How are they infected? Airborne. And you know, we had gotten to the point where we didn't see this that much, and my daughter's at Ohio State, and we had a mumps outbreak. That was crazy. Disneyland had a measles outbreak. So again, these are things that you care about. Okay, standard precautions, that's our Jay-Z rhyme. Everything that I just read to you on the pink sheet, the little pink packet is up there under standard precautions. Okay, so, and then protective, you know, private room kind of thing. Now, when we start to help the student understand what in the world is going on with my responsibilities, I came up with like principles. So on your notes, you're going to literally put as a heading, principles of infectious disease precautions. That's your heading. Principles of infectious disease precautions.